Hi everyone, I'm Patrick Miller, a well-controlled diabetic for 18 years. Having had the disease for a longer period of time, I wanted to give some information to those that are newer to the disease, which could be helpful. This is the Diabetic Channel, where we provide useful information for diabetes. We're trying to get to 500 subscribers, and subscribing to the channel could really help us out. If you could hit the subscribe button, that would be awesome. I wanted to talk about low blood sugar and what are the rules of thumb for dealing with it. Hypoglycemia, or low blood sugar, happens when the glucose or sugar in your blood drops below 70 milligrams per deciliter, or 3.9 millimoles per liter. This requires immediate treatment by drinking something with sugar in it. This is because your brain needs a continuous supply of glucose to function properly, and without enough glucose, your brain can't function. Hypoglycemia is common in people with diabetes, especially people who take insulin. One study found that 80% of people with type 1 diabetes and nearly 50% of all people with type 2 who take insulin reported low blood sugar episodes at least once in the past month. Signs of hypoglycemia are unpleasant and can be scary for both the diabetic and those around them. The signs include shaking or trembling, weakness, sweating and chills, extreme hunger, fast heart rate, dizziness or lightheadedness, confusion or trouble concentrating, anxiety or irritability, pale color in your face, and or tingling or numbness in your lips, tongue, or cheeks. Signs of severe hypoglycemia include blurred or double vision, slurred speech, difficulty with coordination, being disorientated, seizures, loss of consciousness, and in rare cases, coma and or death. In a nutshell, it's often described that a person with severe hypoglycemia acts like a drunk, except this is a severe medical condition. Some people with low blood sugar don't have symptoms or don't notice the symptoms. This, in the medical community, is called hypoglycemia unawareness and can happen in people with diabetes who live with chronic low blood sugar. In these instances, the body stops having symptoms. There are a few ways to solve for hypoglycemia unawareness. The first and probably the best option is getting a continuous glucose monitor. A continuous glucose monitor will alert you, which is particularly important at night when you are sleeping and if you fall low. In addition, a continuous glucose monitor can alert a loved one as well. This was a game changer for me, as I do periodically have low blood sugar overnight, and my continuous glucose monitor awakens me so that I can solve for the problem. Another way to solve for hypoglycemia unawareness is more frequent blood sugar checks. And the final way to solve for hypoglycemia unawareness is a specially trained service dog, which will alert you when you have low blood sugar. Common situations that can lead to hypoglycemia is taking too much insulin, the wrong insulin. For example, you meant to take your long-acting insulin, but you took your short-acting insulin, injecting insulin into your muscle instead of your fat tissue, waiting too long to eat a meal after taking insulin, being more active than usual, taking too much or too high of a dose of oral diabetes medication, drinking alcohol without eating meals later than usual, or skipping meals, and not balancing meals by including fat, protein, and fiber. The American Diabetes Association recommends the 15-15 rule with mild to moderate hypoglycemia. The rule is to eat or drink 15 grams of fast-acting carbs to raise your blood sugar, and after 15 minutes, check your blood sugar. If it is below 70 milligrams per deciliter, have another 15 grams of fast-acting carbs and wait another 15 minutes. Repeat this until your blood sugar is at least 70 milligrams per deciliter. So what contains 15 grams of fast-acting carbs? 4 ounces of juice or regular soda, 1 tablespoon of honey, and 3 or 4 glucose tablets. But you should read the label on the tablets, as each brand differs slightly. The key to why we want to act fast is that we are starving the brain of food. If your sugar level is at 69 milligrams per deciliter, you have mild hypoglycemia, and hypoglycemia is not going to solve its own problem. Moreover, the likely scenario is that the blood sugar is going to continue to fall. So what started out as a rational person who could drink some juice can turn into an irrational person who is having a severe medical issue. This is why it is recommended that you use a fast-acting carb, which can take about 15 minutes to get into your bloodstream. What exactly is 4 ounces of juice? I struggled with this when I was first diagnosed. 4 ounces is roughly 2.5 shot glasses of juice. I think about it as a very large mouthful on an average adult. If you want to get very precise, a lot of measuring cups for liquids have ounces written on it, which you can measure out. Now, before I drink any juice, I go through a few questions in my head. I am low, but what does that mean? Low is a vague term. Am I at 69 milligrams per deciliter or am I at 50 milligrams per deciliter? 4 ounces of juice should raise my blood sugar about 50 points. So my 69 milligrams per deciliter will turn into 119 milligrams per deciliter in 15 minutes. And my 50 milligrams per deciliter will turn into 100 milligrams per deciliter in 15 minutes. The second question I have is, why is my blood sugar low? Is it because I took too much insulin? And if so, how much extra did I suspect I took? It's potential I need more than 4 ounces of juice if I took too much insulin. Or is my glucose low because I did not eat a lot today and I've just been bobbling around the 70 milligrams per deciliter, in which case I might need slightly less than 4 ounces. If I don't know the answer to these questions, the default answer is 4 ounces. Finally, what does my blood glucose graph look like from my continuous glucose monitor? Am I falling like a rock? Or is it ever so slightly falling? The key is I likely need 4 ounces, but do I need more, and can I work out how much more do I need? Now, because fruit juice does not contain much or any protein, fiber, or fat, it will boost your blood sugar, but it is unlikely to hold it there because of this lack of protein, fiber, or fat. So eating a little will keep the blood sugars from going back low. I personally change this rule of thumb if I am sleeping or if I am not. If I am awakened in the middle of the night with low blood sugars, I will drink the 4 ounces of juice and eat either 2 crackers or 1/4 of a graham cracker for mild hypoglycemia. However, if I was low during the day and I was moving my body around, I would double the food intake. So 4 crackers or a half of a graham cracker. This formula normally keeps my blood sugar from falling back low. I hope that helps. If you have questions, please put them in the comment section and I will try to make a video about it.